The Alzheimer's Association has put together a brilliant list. They call it a red flag changes in mental functioning. And they say that there are 10 warning signs that may signal that a person has Alzheimer's disease. And I'm going to tell you all 10 of these signal points, these power points that indicate that you or somebody you know, somebody in your environment, maybe your spouse or your parents or somebody, is having this kind of progressive difficulty, and that transition from normal forgetting into dementia is really taking place. So here are the 10 very important flags, they call it, red flag changes that may signal a person is heading for dementia or Alzheimer's disease. And while I'm doing this, think about yourself and think about people that you care for. And if you can, write these down. I'd really like you to tell other people. Don't try to write these down if you're driving that cab or car. Please do not make an attempt to do that. I'll repeat them over and over again, and we'll get them up on the website. But if you are home or if you're at work and you can do this, this is the kind of information I want you to have so that you can share it with other people. Okay, number one, memory loss that disrupts your daily life. It's not an occasional, you're forgetting things, but this memory loss you're noticing, or people are noticing about you, that is really disrupting your everyday life. You're forgetting people's names. You're repeating the same story over and over again. You're getting lost going to the store. You're forgetting where you're putting things. And this is happening more and more. And you're getting moody. You're getting anxious. You're starting to isolate and not communicate with people. So this starts to disrupt yourself on a daily life. So that's number one. Memory loss that interferes with, that disrupts your everyday life. And you know, you've seen situations like that. I remember with my mom, the first thing I saw about her when she got into dementia, and she was only, I guess, in her early 60s, she was saying the same thing over and over and over again. You know, she would say to me, Alan, my mom was in a wheelchair. She had polio when I was a kid. So she would say, I'd have to take her every place she went, me or my dad, or my sister would have to take her places. And she'd say, Alan, will you take me to the drugstore? I need to get some stuff. And I'd say, sure, Mom, give me a few minutes. I'll get dressed and whatever. And then she would say it again and again and again. And even after we went to the drugstore, she'd say, can you take me to the drugstore? So, you know, you see that this kind of memory loss was disrupting her everyday life and our everyday life as her family. So that's number one. Number two, challenges in planning or solving problems. Now, they don't have to be major, big problems. It's little problems like cleaning the house. It actually becomes a challenge to clean the house, a challenge to do all sorts of things. And you're having problems making plans to do things. You keep reiterating them. You keep going over them, and then you keep disregarding them, and you start all over again. So it's challenges in planning or solving problems. Number three, difficulty completing familiar tasks at home, at work, or at leisure. You're just having difficulty doing things that you've always done with no problem. You know, even I remember a patient telling me that her husband they lived in a projects, and he went to take the garbage out, you know, from his apartment down the hall to the incinerator. I mean, I did that forever growing up in the projects. That was my job. Alan, take out the garbage. So he went out to take out the garbage, and 5-10 minutes later, his wife realized, gee, where's Ben? And she went out into the hall, and he was literally baffled as to where the incinerator was. And there were like 10 or 11 apartments on the floor, and he was standing in front of another apartment door. And she said, what's wrong? He said, I didn't know if I lived here. I didn't know if this was the incinerator. I was just very confused. Now, that's a familiar task that Ben had been doing for 30 or 40 years. And that's just one example. So any kind of difficulty completing a task at home, like taking out the garbage, or at work, doing your familiar job that you've done forever, or at leisure, you're just not knowing what you're doing and you can't even relax. So difficulty completing familiar tasks at home, at work, or at leisure. Those are the first three. One more, then we'll take a break. Confusion with time or place. Basically, you're confused. You have no real concept many times as to what time it is. And I've seen patients that have asked the time, what time is it, over and over and over again. And when you tell them it's 2 o'clock, it's 3 o'clock, it means nothing. There's no significance to it. They'll ask you again, and where am I? Well, you're home. but it doesn't look like I'm home. You're home, you're in the living room. You know, it sounds startling, but you can live in an apartment for 20, 30 years or a home and wind up in a situation where you don't recognize where you are. You're confused about everything. This is pretty darn tough.